Good afternoon, everybody. Welcome to the United Patients Group Ask the Pharmacist series. We get a lot of questions about what the dispensary experience is like and what patients should expect. And we thought that we would put a few short videos together for everybody to watch and hopefully have a better experience in the dispensary and a much more comfortable experience in the dispensary as well when they go. So today we'll be going through a few questions, most popular questions that we get about what you should know before going into a dispensary, what you should do before going into a dispensary, and if you need a medical card before going into your dispensary. So when you're going into the dispensary, what should you know before that you go for your visit? So first thing is you want to know how you want to consume. That's going to determine what delivery methods. Do you want to smoke, vape, use edibles, tablets, capsules, tinctures, something sublingually under the tongue? Having those decisions in mind when you go in can definitely help narrow the options that you have and narrow down what particular products it is that you're going to use. So you're not so overwhelmed with all of the different options that you have. And you're also going to want to know and maybe even make notes of what symptoms you're looking for relief of specifically. Are you looking for help with anxiety, pain, nausea? And be very specific about it. It's not so much about a condition that you have, whether that's cancer or PTSD or anything in between. We're really in the beginning looking to help with what symptoms you're looking for relief of. And have an idea of a budget. That's definitely a good idea. Make sure you have a pretty set budget. Again, it's very easy to be overwhelmed when you go into the dispensary. So knowing what you want to consume and how you want to consume, knowing what symptoms you're looking for relief of, and how much money you want to spend are good things to know ahead of time. Now, what should you do before going into the dispensary? Go online, check out the reviews of some of the dispensaries that are close to you, and check out their websites. It's going to give you an idea of what options they have. Do they have some options for you that are what you're looking to use? Are there other dispensaries that have better options for you for what you're looking to use or how you would like to consume? It's also going to give you an idea of cost and what other products they might have, and maybe help you narrow down the delivery method that you would choose. I would also recommend calling the dispensary to see if you need to make an appointment to speak with somebody that might be able to help you best. That way you can have a comfortable time that you can spend with them and they're not rushed trying to get through you just so they can help somebody else. And then finally, again, stick to your budget. Don't get upsold. It's important that you go there and stick with just a couple of products. That way, you know what's working, what isn't, and you don't get overwhelmed by the number of products that you have. You don't start with 4 or 5 different medications when you go to see the doctor. They'll usually start you with a couple and see how that goes. And then they can go on and try different things if those aren't working, or go, expand from there. And you don't need to purchase a ton. In the beginning, you want to anticipate making a few visits more quickly closer to each other, rather than picking up an entire month's supply. You don't know what your dose is. You don't know how you're going to prefer to consume so far. So make sure that you give yourself, just a little bit. Don't get too overwhelmed, so that you can remember what it is you're using when you get home, what it's supposed to do, how you're supposed to consume it, and when. And then finally, will you need a medical card to purchase at your dispensary? Well, that's going to be a relative question from state to state. So again, it should notate that on the dispensary's website. Some states, most states at this point that have a medical program also have an adult use program, so you may not need a medical card. Some states do reciprocate, so your card that's good in one state might be good in another. But I would be very careful if you're going from one state to another. You don't really want to travel with product on you. Getting pulled over can be a problem if you don't know the laws in those states. And if you're going to be traveling, I would look ahead of time at what the laws in those states are, if you'll be able to purchase your medication there as well, if your card will be valid, or if you'll have to make other arrangements. So I hope that helps today. That clears everything up for our first video series. And I hope everybody found this to be very informative, and we look forward to doing more of them with you. please send in some questions that you have. We can't wait to hear from everybody about if this is helping or how we can improve this. Thank you so much, and everybody have a great evening.